Welcome to the Therapist Thrival Guide. My name is Miranda Barker, and I am here with Marisa and Madeline, who are both Ellie employees. Do you want to both introduce yourself and kind of share a little bit about what you do at Ellie?
Yeah, sure. We work with the outreach department for the Ellie franchise side. And so what we do is we really help try to support our franchise owners and our clinic directors out in the field and provide them with the tips and the resources that they need to do effective outreach in their communities.
Awesome. And Marisa, you are a social worker? I can't remember what your license is.
No, I have my master's in counseling. I never actually went the full licensure path. I did the dual track for mental health and school counseling when I was in school, but I worked primarily as a school counselor for about 17 years.
I can't believe that you worked somewhere for 17 years. That's amazing. Oh my goodness.
Well, it wasn't the same place, but yes, I know. I give myself props for sticking it out for as long as I did in the school
amazing.
systems.
So could you both or one of you kind of describe what is outreach? Like when we talk about the outreach team, what does that mean, outreach?
Yeah, so outreach is more of the interpersonal side of marketing, which is like human interaction. We want to really take a look at our target audience and kind of figure out how can we interact with them and kind of create these long-term relationships that will eventually translate into referrals and partnerships that will really benefit the clinics over time.
Awesome. So here's what I'm hoping for this episode. I'm hoping that whether you are an Ellie franchise owner, an Ellie clinic director, you're in private practice, wherever you are in therapy, in the therapy world, you can listen to this episode and get a lot of really good tricks and ideas for how to maximize your outreach and build some of those referral partnerships. One of the things that I've been thinking about as we were preparing for this episode is, well, number one, you guys just have so many good ideas. I'm excited to dive into it all. But outreach is all about relationship. It's not about just like showing up somewhere and handing out business cards or like showing up to the same conference every year. It's about like actually nurturing those relationships. And that's an aspect of outreach I don't think I really understood or realized until I was reading your guide for outreach the other day. And so I'm hoping that we can kind of talk a little bit more about why that relationship is so important and how to actually foster and like build those relationships. So where do you guys want to start?
Well, I think, like you just said, I think a lot of times people just are a little, especially on the clinician side, we are the people in the background. We're not the forefront and put the spotlight on me. We're healers. We're nurturers. And so that's not our thing. It's not. And people think like outreach is very gimmicky or salesy. And it's like, oh, I don't want to go in and I don't want to, put pressure on people to do anything. And it's really not like that at all. And I think that's like the biggest misconception of outreach is like that we're trying to push something on people that they don't want, or that it's going to be misconstrued or not received well.
It's nerve-wracking for some people.
Yeah, it really is. And I'm not going to lie. It was really, for me, it was kind of outside of my comfort zone when I first got into the field, because it's not something that I normally always did. And going up to strangers and talking to strangers. And sometimes you just got to be comfortable with being uncomfortable just for a bit. And then once you realize it's not bad at all.
Mm-hmm.
It's almost like you become friends with the people that you're conducting outreach with. Yeah. So I never really realized, because I'm a talker. I love to talk to people. I love to go up and say hi. And I never really realized that I was actually going to be creating relationships for myself as well. It's like people want to talk about their dog and their kids instead of, everything clinical, everything about the clinic. It's more about creating that genuine relationship. And then you can kind of slip in those Ellie clinic or any clinic ideas.
It kind of reminds me, do either of you watch The Office?
Oh yeah.
It kind of reminds me, just as you were talking, it made me think of that episode where I think it's like Jim and Steve Carell's character, Michael, when they went out on like a sales call. And Jim just like keeps wanting to talk about like, our paper is better, our paper is this way. And he's very salesy. But Michael is like, how's your daughter doing? And how's, and just kind of he's nurturing that relationship. He's talking more. He remembers things about these people and wants to like actually have a genuine connection. And just as you were talking about that, it reminded me of that, because you're right. I think when a lot of therapists or people think about outreach, they think about, I'm going to have to go staff a table at Pride, or I'm going to have to, email every, family lawyer in my county, or I'm going to have to do X, Y, and Z. And while it might be some of that, I think that it's got to be a balance, right?
Absolutely.
So,
yeah, I think.
Yeah, go ahead.
Oh, no. I think the biggest thing is just bringing your authentic self and who you are. And, that's one of the big core values here at Ellie, is just being authentic. And it really does shine through. People value when they know that you're being real with them. I mean, people have the BS, will go light will go off real quick if they know that you're not being genuine. Mm-hmm. And so it's just really, it's interesting in so many of the meetings that we've had, and just how you just vibe and you just go off, and that something that you thought was going to be like a 15-minute meeting turns into an hour-long meeting, and you find out that you guys work at the same gym, or it's just those, like Madeline said, it's just making those genuine connections, and you realize, I can actually be friends with this person outside.
So you could walk in and sorry, go ahead. I forgot what I was going to say now.
I mean, it is all about connection, but where do you recommend people start typically? Because there is kind of this, yes, it's about relationship, but you've got to start somewhere. I mean, what's the first step of outreach, or what's the first thing that you typically recommend people do when they're starting their outreach?
It does take some planning. You don't really want to kind of jump in. Yeah, you don't really want to jump in blind. And, we're in the mental health field, so we're going to start probably on Google, honestly, and look at, what are those geographical places that are so near to your clinic, places that people can walk over, or, it's a mile away, they can stop in on their lunch break, whatever it is. And just really starting to define where, those targets are. And then building a planner, which can help you kind of stay organized and stay on track. And a calendar is really helpful as well. Making sure that you know exactly what you're getting into can help it seem a little bit less intimidating. So that's where I would start. I'm sure Marisa kind of feels the same, but probably has some other insight as well.
Yeah, I feel like the basis of having an effective outreach strategy is that pre-planning and that research that goes in ahead of time. And I think a lot of times people don't realize how much that does play a key role in it, and how much time it does take to do that. Because it's more effective when you're going somewhere and you know who you're going to speak with, or you actually take the time to find out the actual stakeholder in the organization that you want to go to, and maybe schedule a meeting beforehand. But that does take time. You're on websites, you're going through different pages, trying to find the right person to get in touch with. You're making calls, asking questions. So it takes quite a bit of pre-planning ahead of time before you actually jump out there.
So when we're talking about outreach, are we looking for referral partners or clients, or both? Like, who are you kind of focusing on for outreach?
I think it's all of the above. You can do it depends. You have to set your clear objectives and your goals of what you're really trying to focus on. And obviously for new clinics, you're wanting referrals to come in, but you're also needing to make connections with referral partners, bring brand awareness, letting people know that your clinic is even open and who you are and the services that you're providing. So, and sometimes you're looking to recruit for doing outreach for recruitment efforts to get clinicians or, employees. So it can be all of the above, I think.
Kind of goes hand in hand sometimes. Like you could walk into, let's say, a doctor's office, and you're just saying, hey, we just opened up down the street. I'd love to get some contact information for your office manager or whoever that stakeholder is. And the front desk person might be like, oh, well, I've been looking for a therapist for my kiddo for the past month, and I can't find anything that fits for me. And then it's like, oh, well, how about Ellie? And we talk a little bit about that. And it kind of becomes that client conversation as well.
So you kind of talk about, pre-planning is super important, and then trying to maybe start at what's geographically close to you. And are you talking about like starting at kind of any business? Are you talking about healthcare? Like, what are you looking for that's kind of around that clinic usually?
I mean,
I'm assuming you're not like walking into a dry cleaner, but you're probably just, but maybe you are.
Maybe
know.
you are. You absolutely could walk into a dry cleaners and leave some flyers or something. I mean, you're probably not going to create the best referral relationship with a dry cleaner. But it really kind of depends. So medical offices are just a really fantastic resource for people. I know personally for me, when I was looking for a therapist, I've talked about this before, but when I was looking for a therapist for myself, I asked my doctor, I asked urgent cares, and everyone just said, I have nothing for you. I can't give you a recommendation. So a lot of the times doctors in doctors' offices are not thinking about the mental health side of things. So they are really looking for resources. And I would say in the beginning stages, like if you're in an office building and you have a bunch of different businesses around, absolutely go say hi to all of those businesses. And you really want to kind of fine tune eventually as you go on. But I mean, there's only so many places that you can go to, right? So eventually you're probably going to end up saying hi to everyone, I feel like, if that makes sense.
Mm-hmm.
And I would also say, don't discount the other therapists that are near you. I think a lot of times in the mental health in our space, we find that a lot of our clinic owners or directors are afraid to go to other therapist offices because they think we may be encroaching upon, their client. But we all know that everyone has wait lists these days. And, sometimes these wait lists are months, weeks long. And so if they know that there's a resource that they can refer out to, and another great thing is a lot of private practices don't take insurance. And so they're getting calls for people who would like to use their insurance to get therapy. And so if they know that there is a clinic in the area just down the road that does accept insurance, they'll send them on. So don't discount that as well.
I do have like kind of a little story about that. Actually, I was in Memphis on an outreach meeting with some really awesome Ellie people. And we actually ended up meeting with another therapy clinic. And it was this really awesome woman who had started her private practice, and she had a few therapists on her team. And when we sat down to talk to her, we just had the really great conversation going. She found out that the person that I was with, the therapist that I was with, actually knew one of her therapists. It was all like a small world type thing. But she ended up saying, I never refer people out because she has a wait list. So let's just preface that there. But she said she never refers people out because no one has taken the time to come in and actually have a conversation with her. And she would never want to send someone out to someone that she wouldn't recommend. So if she doesn't know them, how can she recommend them, kind of thing?
Yep. So that is such a good point. I mean, I like as a therapist myself, I get that, like wanting to be able to say really confidently to my client, like, hey, I might not be the best fit, but I have somebody that I think would be really helpful. And so, I mean, that's one of the benefits of being at Ellie, where I have this great network of therapists. I know a lot of therapists. And so I can, I just came back from maternity leave, for example. And so while I was on maternity leave, or when I was prepping for it, one of my clients was like, hey, I really think I'd like to try EMDR while I'm out. And I was like, I'm not an EMDR practitioner, but man, do I have the perfect EMDR therapist for you. And so I could have that handoff to my colleague while I was out. But I think in that same scenario, Madeline, where like you do want to make sure that your clients are getting the best care, that you're not referring them to a shitty therapist, because there are lots of shitty therapists out there, and you don't want to refer to someone who kind of looks bad on yourself then, and so that's such a good point, where like establishing that relationship and not being afraid of reaching out to therapists can be so helpful. So I wanted to say one more thing too, where like you make a good point, where a lot of private practices are cash pay. And so they're getting calls about, do you take insurance? And it's great for them to be able to say, no, but here's a clinic that's, just a mile up the road or close by that does. And so being able to say, here's another option is really helpful. But even like, I think that a lot of therapists, they don't do a great job of really establishing their niche when or maybe what I should say instead is like, a lot of therapists want to be practicing within their niche, but they feel pressured to like take clients, whoever calls them, or has difficulty knowing who to refer to outside of their niche. And I think that as practitioners, we have a whole episode that we did on this like a year ago about like finding your niche and establishing your niche. But as practitioners, it can be so helpful to be like, okay, this is my niche. I am a trauma therapist, or like I am an adoption therapist. I am a, life transition therapist, whatever, couples therapist. And then being able to really dig into that niche and then, partnering with other therapists that are outside of your niche that you can then refer to, it can be so beneficial. And so again, like just another really important reason to connect with the therapists and the private practices in your area, because they can, take on clients that maybe you don't have capacity for, or you feel like are outside of your realm, or maybe you have a client who really could use family therapy or could really use couples therapy. And so you want to be able to collaborate with another clinic in your network can be so valuable. I'll say one more thing about like healthcare professionals, and then I want to kind of dive into some other areas of outreach too. But a couple of years ago, I went on anxiety medication, and I was just talking to my my primary care physician, and I was like, I've just been feeling so anxious. I think I could use medication. And one of the things she said was, medication is the most helpful when it's paired with therapy. And so, yeah, I'll prescribe you citalopram. I was on citalopram for a couple of years. I'll prescribe you this, but really recommend that you check out some therapy options as well. And so she herself did not give me a referral for that, but like, how valuable would it be for healthcare professionals to be like, listen, I know the research, I know that this is what's going to be helpful, but really like, here's another option for you to also address your mental health needs. So I love that. But okay, so we talked about healthcare. We talked about like kind of initial first steps, reaching out to other therapists in your area. What are some other areas for outreach or places that you recommend like clinic owners or clinicians start or go to?
Well, I would say you definitely want to know what your clinic specializes in. So what therapist that you've hired on, like if you don't have a therapist that likes to see children in your clinic, then I would not suggest going to the schools and starting off preliminary outreach. So it's like you want to kind of meet the needs of what your therapists have to drive your outreach efforts. If you have like a play therapist, then yes, absolutely. Hit those schools. You're going to want to go to tutoring centers, places where kids will be. I'm
Marisa,
sorry, my cat is attacking me.
Marisa, do you recommend that people just like show up at schools, or like how do you recommend people outreach at like some of like schools or tutoring centers?
Yeah, I'm glad you brought that up, because schools is one of those tricky ones that we have found. It's a hit or miss kind of thing. And again, it comes down to that research and doing preliminary before you go out there. Because a lot of times school districts are different from county to county or town to town, and how they take their mental health referrals. And so some school districts, pretty much the bigger ones, sometimes you may have to go through a higher level and contact someone at their school district office, at their counseling department or their mental health or their health services department, and actually go through them first, because sometimes they're a gatekeeper and you'll have to go through them before they can disseminate anything to the individual schools. Then other times there's districts that will allow you that the individual schools manage their own referrals. And so you can contact either the school counselor or some up north, I see sometimes they have a psychologist on there or a social worker sometimes. And so you really don't know until you actually do the research who it is that you're going to need to contact. But having that contact prior to going and walking into a school is going to help you, because as we all know, most schools are on lockdown now, like they're all locked. So you'll walk up and you'll have to ring a doorbell. And so it really transcends better when you actually have somebody's name when you're calling to enter a school. You'll definitely want to keep trying, because as a school counselor, we wear many, many hats, and there goes my light. And so it's hard to always be able just for them to respond to you right away. So you'll definitely want to continue and do follow up with the schools for sure to get with them.
That safety component, that safety component is really, really prominent in schools. So if you are just trying to drop off, pretty much 90% of the time, they're just going to say, oh, thank you, we'll take that.
Yeah.
And you won't actually get in to talk to the counselors or anything like that. I have before, but it's not as likely. So if you are having a hard time reaching out to someone in a preliminary manner and you do want to go drop off, whoever comes to that door, I would be like, who can I talk to? Who is the main contact that I need to get in touch with to get the word out here? Because what we want to do is provide support for your students, for your staff, for your families, whatever it is. It is a tricky one for sure, though, for sure.
What are some other areas? I mean, so we talked about healthcare, schools. Where are some other places that people might try to make some partnerships or like referral partners?
Well, Miranda, you did mention earlier, we were talking a little bit about medication management. Psychiatrists are a huge referral source, because a lot of the times they either don't provide therapy or they're on a super long wait list. And I mean, they're going to be on a long wait list for medication management as well. Let's be honest. But a lot of the times they are looking for therapists to partner with. And if you really do create a really awesome relationship with this person or with this clinic, then you might have someone that you can send your clients to as well. So everyone wants referrals, right? But it does go both ways. Creating those relationships is also kind of a gateway to finding people that might be able to support your clients in a different way as well.
That's a good point, where like searching out and seeking out referral partners that can be mutually beneficial, where you're referring people their way, they're referring people your way. Absolutely. I think that can be really, and they're more likely to refer to you then too, if they feel like they're going to, kind of get something out of it as well. But
TMS clinics are a good one as well.
Okay. Yeah, that's it. So that brings up another good point, where it's like almost like specialty clinics, like TMS clinics, ketamine clinics. I wonder even like, do y'all do much outreach with like partial hospitalization or or like inpatient clinics or places that have like higher levels of care, and maybe they're looking for, referral partners for when their clients are dropping down to outpatient care?
Absolutely. That's a huge one for us as well. One thing that I do like to mention when we're talking about this, of course, you can go into an inpatient facility or a residential treatment center and conduct outreach with them and kind of create that relationship. But I do want people to keep in mind that there is that hierarchy of those different levels of care. So those people coming out of residential might be going to that partial hospitalization or that IOP that's a little bit more intense than just weekly therapy. But eventually they might make their way down, and it depends on whether or not that facility has their own IOP or PHP, whatever it is. But I like doing outreach with IOP instead, just because you know that the next step down is weekly therapy.
That's a great point.
And that's usually where we'll probably, if our clients need that higher level, we want to know that we have them as well as a partner that we trust sending them to. And nowadays, with the space now, there's a lot of virtual IOPs as well as the physical ones. And so getting to know the resources that are in your community is going to be huge.
Absolutely. So let's switch gears a little bit. I'm curious about like conferences and like doing outreach kind of like setting up a table places, that sort of outreach. What is it worth it? I guess maybe that's one of my questions. Like, is it worth it? And what are some things that you guys recommend for like planning around conferences or, like having the most successful conference experience?
Yeah, I definitely think it's worth it. It may be on the higher end when we're looking at spending for outreach, because it does cost money to do that. And so my recommendation would be like, let's partner up and collaborate. Find another clinic that's in your area that it'll make it worthwhile to split the cost between 2 or 3 clinics. And then it's not so bad. And then you have enough people to manage it at the same time. But it's definitely worth it. Number one, especially for new clinics that are starting out, you definitely need that brand awareness. People don't know who you are. Maybe they're starting to see your ads online and they're recognizing the elephant, because everybody does once they see it. They love it. And to put a face with the name and then it's building that trust. It's, you're letting people know who you are, what you're bringing to the community. It's good for client referrals. It's good for possibly recruitment of clinicians, knowing that you're in their space and it's another opportunity for them. It's just all around. I think it's a really good thing. Now, to do them every single year, maybe not, but there's, there's certain ones that it may be important to do, like NAMI walks, because that is directly related to what we do. And we're supporting our community and what we're here for.
And to Marissa's point about collaboration, I think that is the absolute best way to go about it if you are doing a conference, because it also takes some of the pressure off of you. It's not just your thing. You're going in and you're the one that has to be there at the booth the entire time. You can have different therapists at the booth at different times and talking about their different specialties and walking around and meeting with different booths that might have to do more with their specialty, because I think it is really important in outreach, especially if you are sharing the responsibility with some of your therapists, that you do really align your plan towards specialties. So like Marisa was saying earlier, if you have someone that wants to see the kiddos, maybe send them to the schools. But that's kind of the same thing with being at a conference. Being at a conference is you get to kind of show off all the different services that you get to provide for the community.
And not all conferences are made the same. Let's just put that out there. You definitely want to vet your conferences before and read up again. Do your due diligence, do your research ahead of time. It's going to take some time, but go to the websites, go through, see who they partnered up. How long has the conference been going on? What are the different levels of sponsorship? What are you getting in return for it? A lot of times conferences, they'll give you tickets. And so you can send your clinicians to get CEUs for those conferences. And that comes in handy. Sometimes they offer meals. Sometimes it's just, you really have to look through and vet and see, what am I getting for it? Is it worth it? Advertising and different things like that. So just make sure you try to pre-plan for that.
What's it called, Marisa? I can't remember. It's like an exhibitor prospectus.
Mm-hmm.
Prospectus.
What does that mean?
It's a document that most conferences will have, and it will talk about kind of exactly what Marisa was just saying. It'll even include how many attendees are expected to be there. So if you have a conference that you want to go to, you think it's a great idea, and it's really, really expensive, and you look and see, and you're like, okay, maybe that's actually not that many people that have been there in the past. It will show you how many people have previously attended and how many people are expected, all that kind of good stuff that will help you
and the demographics of the attendees. And so
is this for other clinicians? Is this for healthcare professionals? Is this for school counselors? And what does their background look like? It's a really, really helpful tool when you're going and planning on heading to a conference.
What about like community events like Pride or other places that you might set up a table and it's not necessarily a conference, but it's like a community event? Like what are some of your tips or thoughts on like staffing some of those different events?
Well, those are more relaxed, I think, and they're the more fun events to do. There's not as many rules. Whereas like an actual professional conference, they have a lot of rules that you have to follow as far as staffing and whatnot. When you do those community events, you can likely have more people behind your table, and it's like you have a little bit more freedom to have fun with it and be more engaging. And I think the more that you can engage your crowd and have something that brings people to your table that they want to interact with you, and like if you have music going or you have fun giveaways, that's or like a table for interactive for the kids or something for the pets, draw people into your table that they're going to want to come to see you. And like, what's going on here?
I love that idea.
You want to have kind of a big personality as well for those kind of events, because at a conference, people are going to be going into their sessions and there's going to be like a quiet period where it's just you and the other people that are exhibitors at the conference. And
which,
like,
by the way, good, like that's another good like place for referrals. I mean, just to be able to referral partners. I mean, where like I don't do outreach, you guys. Like I love outreach. It's just not part of my job. However, last week we kind of had, I don't know, a big oops on the marketing team where we were like, oops, we forgot that we had signed up for a conference. And so I got like a 8 p.m. call from one of our marketing gals. And she was like, is there any chance you could join me at this conference tomorrow? And I was like, okay, like that sounds fun. Okay. And so I went with her, and there's a part of me that's like, okay, we'll see. I'm not someone who has a super big outgoing personality at events like this, which might surprise people because I'm like talking on podcasts all the time. But I'm someone who is just like, I'll wait until you approach my table and then I'll talk to you. But I'm sitting next to the marketing gal, and she goes, hey, have you heard of Ellie? Have you heard of Ellie? Hey, how are you doing? I mean, just pulling people in, which I think perfect personality to pull people in that way. But I say this because, first off, if you're more like me, partner with someone who's a little bit more outgoing, someone that can pull people in, and then I can answer the clinical questions. It's fine. But you did kind of we did have those lulls where it was like, okay, everyone went to their sessions, everyone went to the breakouts. And so then it's like, you're in this big hall and it's only the other exhibitors and we're all just sitting at our tables. And I was like, I'm going to go walk around. I'm going to go kind of see who else is here. Yep. I'm going to do a lap. And that was probably the most valuable part of the conference for me, because I ran into old colleagues from old job or from past jobs, or ran into people that I knew from grad school, or, I walked by a table and I was like, oh, I've referred people to you guys, or like, hey, this is an amazing nonprofit. I've never heard of you. And so you kind of have this, that's a nice time where it almost feels like the professionals can just kind of have more conversations, and you're not like on as much as you are when you are staffing your table. But yeah.
I will say it also depends on how big the conference is as well. So I did a conference in Colorado Springs, and it was huge. It was a pretty big conference. So during those lulls, I was walking around trying to like have a short conversation with everyone there. But when I did a conference in Boise, Idaho, it was much smaller, and I got the opportunity to actually really kind of get to know these other kind of potential referral partners, because it's not just about the attendees, it's also about the other people that are there.
How do you both have tips for drawing people into the table? I mean, you said like different giveaways. What are some, maybe let's start with that. What are some good giveaways that you guys have seen that are like attention grabbing, getting people to the table?
It doesn't have to be anything crazy. Like, we don't need to be giving away like an iPhone or anything like that. It really, what people want is recognition that they want something. So it can be something small, like let's say you are trying to, your audience at this conference is clinicians. Maybe you are looking at a package of t-shirts that have more of a clinical meaning behind it. I think we talked about this the other day, Marisa, but like the my amygdala
makes me anxious.
Yeah, makes me anxious t-shirt. Like, that's a little bit more clinician focused. Yeah, everybody sucks sometimes might be one that you could put into a package for people.
Again,
who
these are t-shirts,
might not
guys.
Be yes, t-shirts. T-shirts.
Like my
T-shirts,
shirt.
for sure.
Oh yeah, let that shit go. I love it.
Yeah.
I can for anyone who's listening or watching, I can put links to these t-shirts in the description because they're awesome
amazing.
t-shirts and people love them. And they do get people to stop. I
Absolutely.
love that.
The quirky, anything that has like any quirky phrases or anything that will make people laugh is something that's really, really great to put in a giveaway. I also really love when people are kind of taking into account, like if you're doing an outdoor event, have the little poop bags, the doggy poop bags that say, let that shit go, or have a little sunscreen packet or something like sunglasses, something that goes with what you're doing. If you're indoor, maybe you have something a little bit different, but kind of thinking about where you are, look at your surroundings, think about the theme of the conference, and you can always just put together little packages. It doesn't have to be anything crazy. Like I said, a mug. People love mugs. They love to collect them.
I can tell you the last conference I went to, the hot ticket item, and we didn't have that many of them. But once somebody saw one person with them, they were like hunting our table to come and find them, were the Pride rainbow Ellie bags, the drawstring bags. Gave that out to one person, and then it was just like everybody, it was like hotcakes. Everybody wanted a bag. And it was funny because we were at the hotel, and the second day I'm seeing everybody walking around representing our Ellie with their rainbow bags everywhere.
I love that.
That's kind of another really great point is anything wearable, like the t-shirts or the bags, anything wearable that people might put on again. It also is just like brand awareness for your practice.
What about, so I think one of the things that makes me anxious about doing like staffing conferences or tables like this is I never really know how to like start a conversation with the people that are walking by. Are there any like scripts or things that you would say, like here's something that you could say to get people to stop at your table, or like, here's some good questions you could ask to see, you know, if they're looking for a therapist. Maybe I'm not going to like sit at the table and be like, hey, do you need a therapist? Because then someone might like run really quickly away from you. But I don't know. Do you guys have any like scripts or things that you would recommend people say?
I mean, I think the kind of what you had said when you were at the last clinic, I think the most disarming and just easiest is like, oh, hey, have you heard of Ellie before? Because, you know, chances are probably not, but sometimes they're like, oh yeah, I have. And so and if they don't, that's a perfect segue to kind of talk about mental health and mental. So it's not like you just outright saying, hey, do you need a therapist? We're here. No. Have you heard about Ellie? Oh, great. No, we're a new counseling clinic that just opened up in town, and you know, these are the services that we have. And then somebody might say, oh, I've been looking, or my nephew has been needing a therapist forever. Can I grab your information? So I think, you know, number one is being inviting and engaging. I would recommend not sitting down, because I think you're just a little off. You know, you're not engaged and you're kind of aloof. And so, but if you're standing and you're looking at people and smiling, just sometimes a simple smile will make somebody feel like, oh, I can approach them and come to the table. And a lot of times I think, you know, people are there because they're nosy and they want to see what kind of swag you have. And so, yeah, come on over. Yeah, check out. We got the best swag here. You know, grab something, help yourself. And then while they're standing there, just striking up a conversation. Oh, where are you from? Oh, what do you do? Oh, really? Oh, you're an LPC, or you're in grad school right now getting your licensure. Oh, that's great. You know, let me tell you about our clinic. You know, it was founded by clinicians, made for clinicians, a safe space for them, you know, to feel comfortable working. And we know burnout is real in this industry. And so we really try to combat that with our clinicians, and you just get into a conversation. So
Marisa, you're so good. I love it.
One thing that I kind of do, and I think it's probably a little bit unconventional, and I practice this in my everyday life, is every single day I try to compliment another person on something. And if I don't leave my house, then I compliment myself. But I will...
Madeline, you look great today.
Yes. I will compliment them on something like, oh, I love your shoes. Where did you get those? And then I kind of like draw them in that way. And then I'm like, oh, start the whole, have you heard of Ellie? Or what do you do for work is also another great one, because you're kind of gauging where you need the conversation to go. Like, oh, that's a therapist. They might be looking for a job, or, oh, like they might need a therapist or referral partners or whatever it is.
Great tips. So, okay. We talked about like high level. Here's like how we are, getting referral partners. Here's how we're kind of getting our name out there. Once you meet them, once you talk to people at a conference, how do you actually nurture that relationship then? How do you move from like, okay, I met this person at a conference to we are actually establishing a connection and doing like the meat of outreach, which is nurturing those relationships?
Very good. Because that's a huge piece that we find is lost a lot of times. Just in the outreach efforts that we have done thus far, is the follow-up is key in keeping a relationship going, and even in getting one going, because you have to continually be in front of people for them to remember you. And whether you're getting referrals from a referral partner, or you've noticed a drop off in referrals, or you haven't gotten any, it's always good to kind of bounce back in front of them and check in on them. And especially if you've made those relationships and you've connected with them on a personal level, hey, just send them a Happy New Year text, or if you remember that their child had a dance recital, how did the recital go? Wouldn't you do that with your friends? Just keeping up with them and what's going on. If you don't have that established relationship with them, you definitely want to keep them in the loop of what's going on at your clinic. If you're hiring on new clinicians, or if you're having your open house event, or if you're, you've got a new service that's coming on, send out regular emails. Now, you don't want to bombard them all the time, and because people spam, delete, unsubscribe. Exactly.
Like, how many times have you exchanged contact information with someone and you're like, oh my gosh, if this person sends me one more automated email, correct, I am going to explode. So we definitely don't want to be doing that, for sure. And Marissa's approach to keeping it more personalized is really, really beneficial. And that's what's going to make you stand out when you are nurturing that relationship. So if there's nothing wrong than saying, hey, there's nothing wrong with saying, hey, we have this monthly newsletter. Would you like to opt in? But maybe quarterly contacting them again and saying, well, hey, just checking in to see what you're seeing in your community. What are your needs? How can we help you fulfill that? Do you want to grab coffee and talk about it? Anything like that. But keeping it personalized is definitely a really good idea.
So when you're at these different conferences, or if you drop by a doctor's office, these different things, are you asking for their contact information, saying, hey, can I have a business card, and so that I can like send a follow-up email? Or
so I kind of want to tie this back into what we just talked about, which was giveaways. So another great way to conduct this giveaway is put your business card in this box, and we'll draw one out kind of as a raffle type thing. That way you can kind of create a planner more than a calendar with all these people's information. Keeping that organized and in one place can really help you. That's just a way to get contacts. And you definitely should be asking for these people's contact information, because if you have new therapists coming on, if you have new insurances that you're accepting, then absolutely reach out right away and say, hey, we have a new therapist. She's accepting Aetna, Blue Cross Blue Shield, whatever it is. And she's an EMDR therapist who sees whatever age range. Definitely be getting the contact information so that you could be pushing out this kind of really rockin' info for your clinic.
I'm glad that you asked that, Miranda, too, about asking for information, because it's perfectly fine. If you don't know who your contact person is when you're entering a facility, Absolutely. You want to know who is it that I can speak with at a later date? Do you mind giving me their information? But I also like to say, when I am talking with my clinics, is that use it as a recon mission as well, because you're looking to hire on clinicians. And so don't be afraid to ask them, like, what are the gaps that you're finding out there when you're trying to make referrals? Like, who are you having the hardest time finding a therapist for? Or what are some of the pitfalls or the barriers that you're finding? Is it a certain insurance that people are not accepting? Or is it a certain specialty that you have a really hard time finding that there's a huge wait list for? Because that's going to help drive for your recruitment efforts for your clinic.
And I think that's really beneficial when you're first starting out. So if you've just opened your clinic and you have 2 to 3 therapists and you have room for 12 therapists total, when you are having these conversations with your potential referral partners, asking about those gaps and those challenges and any bottlenecks that they've come across can help you build your team around the community instead of, just kind of going willy-nilly, let's get 8 therapists that have the exact same specialty on your
I love
team.
That is such good advice. Like, because then you are truly looking at what your community needs.
Absolutely.
And meeting those needs. And I think that speaks volumes to referral partners and to the community of like, hey, I'm here to serve my community and actually see where those gaps are. And no, that's such good advice. Do you feel like, I know that we're getting close to time. Do you guys feel like we're missing anything or any other tips that you wanted to share with our listeners?
I think just the main thing, and we've talked about this over and over on this podcast, so it hasn't really been, or it's not really a new topic, but please, please, please be yourself. It's like the one thing that I really just want to drive home to everyone, because when you're going and doing outreach, people want to see, who am I sending my clients to? You don't need to be giving like a rehearsed. I understand that people get nervous and it's very intimidating when you're first starting out, but you don't need to have an elevator pitch that you recite word for word. We're not all cookie cutter people. It's kind of like therapy. We all don't fit in one box. We're all not going to fit with one therapist. So be yourself and really just drive home that you are there to support them. And I think that just speaks wonders for them. When you really make it known, like, we are here for you, they really, really appreciate that.
Absolutely. Get comfortable with your Ellie why. I always say, we all said yes to Ellie for a reason. What brought you to Ellie? Like, there's a reason. There's a passion behind it. And if you can speak to that passion and it comes through and people can really get that from you, that's all you need. And so just go back. If all else fails, just go back to your Ellie why. What brought you here? And what's your passion for mental health? Because we're not doing it, for the money.
I'm glad you said that, because I think that for some people who aren't clinicians, like if you are a franchise owner or a clinic manager or something, and you're not a clinician personally, it can feel really intimidating to, put yourself out there with other mental health professionals or go talk to healthcare people, or, it can feel, I think some people can feel like it's disingenuous or something, but it's not, because what you're doing is going back to exactly what you just said, Marisa, where it's like, you got into this for a reason. You have a passion for mental health care. And so drawing on that Ellie, that what we call the Ellie why, drawing on that passion or why you got into this and being able to share that is really what's gonna show that passion, and it's going to really connect with people too. And so I think that's great.
Kind of piggybacking on that, don't be afraid to ask questions, because I've been out with a lot of franchisees who are not clinical at all. And people think it's more genuine when you say, actually, I don't know what that means.
Yes.
Can you tell me what that means? And then that starts a whole new conversation. And then they say, they just make it very clear, like, I'm not clinical. I have no idea what you're talking about.
I love that you said that, because even like the conference that I was just at recently with some of our marketing folks, like, we were standing at the table and a clinician came up and she goes, yep, I work in CTSS and ARMS. And those are for anyone who's not in Minnesota, those are pretty like Minnesota terms. But it's a type of like in-home therapy but anyways, so the clinician said this to the marketing person, and the marketing person goes like, is nodding along. And then she's like, wait a minute, what exactly does that one mean? Or, says those different things. And I was like, I think it is absolutely more authentic to just be like, oh, I don't know that one. And I had even said to her, I was like, I'm a clinician and there are so many acronyms and abbreviations that I don't even understand. And if I hadn't worked in the county previously, then I probably wouldn't know what a waivered service is, And so it's like there's way too many acronyms to begin with. And so I think that people should have grace for themselves and realizing that they're not going to know any of them, and nor should there be an expectation that you're an expert in the mental health field. I don't know. Did you guys ever read the book, How to Win Friends and Influence People?
No, but it's on my list. It's on my list.
It's an old book, but it's great because the number one thing that book talks about is to ask questions more than you're talking. So instead of just talking, like ask questions and be curious, because people like to talk about themselves. People like to feel heard. And so that's going to be the number one way that you're winning friends and influencing people, is by, asking a lot of questions.
I just downloaded that on Audible.
Makes sense.
So.
I love it. No, it's so good. It's great. It's funny. I was giving my husband a hard time because he was reading it a couple years ago. And I was like, are you having trouble making friends? Is that why you're reading that book? And he's like, no, it's actually just a really good book. And so then I read it and I was like, absolutely. No, this is great. But awesome. Well, this was so valuable. Thank you both so much for joining and sharing your wisdom and knowledge and everything you know about outreach. And I feel like there's probably so much that we didn't even cover that we'll have to have y'all back. But this was such a good foundation. And hopefully if you are listening to this episode, you feel much more prepared to put yourself out there and to get some clients and referral partners in new ways. So thank you both so much.
Thanks, Miranda.
Thanks, Miranda.
Jinx.